just like everyone to just have a quick hello and introduce yourself to the rest of the members, because we're going to get to know each other very well over the next 8 to 10 weeks. And just tell them your first name and just say a very brief summary of why you're here. Starting with yourself.
So I'm Chris. I did me back a bit of a nasty back end of last year, and so they to do surgery at the end of the year and just recovered from that.
How long have you had pain for?
I had pain for 12 weeks, so it's the only pain, the only hospital admission, anything I've ever had, but it was acute, it was horrible.
And Julia?
I'm Juliette. I've actually seen David twice now. He fixed a fractured disc in my neck about 7 years ago, which was successful, and now I have another one that's severely herniated, so obviously need to get my back treatment to stop that.
How long have you had back pain?
I've had back pain from this now probably 12 months in May, because I fractured it during the trip. Yeah.
Bernie, how long have you had back pain for?
About 15 years, maybe.
15 years.
Wow.
And come out here, and how long have you had back pain for?
Probably forever. Ever since I started training, nursing sort of when I was about 18, 19. And sort of it's got worse progressively in the last 20 years.
Karen?
Yeah, well, I've just had a few injuries over my lifetime, and I've just gone into bad pain the last 2 years. I mean, you know,
2 years. So, you can see here, most of you have had pain for quite a long time. And I'm going to ask a few other people what strategies you've tried. So, Phil, what would be something that you've tried in the past to get control of your pain?
Oh, just about everything from light exercise, acupuncture, Reiki, constant physiotherapy, too many tablets, I think.
Yep.
And the status quo had to change
Lots
a lot.
of physical methods as well. Physiotherapy you mentioned.
Yes. Yeah.
Dr. Sutherland, what about yourself? What therapies have you tried before you came here? Physical therapies. Other than golf.
Other than golf, yeah. Squats and some stretches that a physiotherapist told us to do.
Physiotherapist.
Yeah.
Any massage therapy, other chiropractic therapy?
No.
Anyone else like to say what treatments they may have tried in the past? Mahala's a little bit hard of hearing, but she lip reads very well. Mahala, what things have you tried? Have you tried lots of physiotherapy for your back pain? You've got back pain, not good therapy. Now, if you look at this space, does this in any way look familiar to the physiotherapy studios that you've attended? No, it's quite different, isn't it? What's the one thing that you notice that is lacking?
No benches.
There's no benches.
Massage benches.
There's no couches, there's no massage benches, that's right. And there's a very good reason for that. And there's a very good reason for us adopting this style of treatment for back pain. Is that our primary goal is to get you moving correctly. Movement. Now, the moment you lay down on a couch or acquire physiotherapy treatment or massage or deep tissue release, you are switching off all of the neurological processes that stimulate body health and movement. So, this comes to one of my philosophies about health, and it's really divided into three. Now, we probably talked about this in our consultation room up at the Brisbane Private. Number one is sleep. Number two is nutrition. Okay. And the final one down here is movement. Now, I'm convinced that if we can master 1, 2, and 3, that from a young age, you can be very healthy for your whole life. In fact, you can die healthy, which is how it used to be. We used to be very healthy all of our lives, and then in the last couple of weeks we get a bit sick and then we die. Nowadays, in medicine, and I see it every single day in my practice and from my experience working in hospitals, patients are healthy, they get sick, and they remain sick for years and years and years before they die. And that's because these elements are not addressed in modern day society. Now, what do we need in sleep? We need 6 to 8 hours. Okay. What do we need in nutrition? We need low insulinemia. And we probably talked a little bit about, I'm not going to dwell on that because we're a functional movement training program, but this is what we're going to spend most of our time talking about. Now let's break down this pyramid into 3 critical elements. What do you think the main elements of healthy movement are?
Flexibility.
Yes. So I'm going to put flexibility here. Okay. What would the base be?
Foundation.
The foundation, and I'm going to call that coordination. Because I can move in an uncoordinated way. If I walk around like this all day, that's not coordinated, and it's unhealthy for me to walk around like that. We have a way of, our body is designed with certain biomechanics, and there's a certain amount of coordination that's required to move healthy. And the last one I'm going to put in there is power or strength, because if we don't have muscular development, then we're not going to be able to move in a powerful way. But at the foundation of healthy movement is coordination. We have to have coordinated movement. In order to be able to move and utilise our coordination, we have to have flexibility in our soft tissues and around our joints, our tendons, our ligaments, our joint capsules. Because no matter how coordinated we are, if we don't have the ability to move that joint due to inflexibility, we can't achieve healthy movement. And then finally, if we tick off coordination and flexibility, our strength will come naturally. That will come. Now, we've talked a lot about your spinal conditions and your back pain, years, months of pain, and we know that there's nothing sinister, there's no tumours, there's no fractures, there's no significant structural integrity deficiency that's causing your pain. So, what's going to fix your pain? It's addressing movement. I'm going to rely on you guys to fix nutrition and sleep, and it's going to be our job and our fantastic coaches who are all functional movement coaches. They have a trained eye to identify deficiencies in coordination, flexibility and power. Okay? That's what a functional movement coach is. And that's the primary reason why a lot of the treatments that you've tried over the years haven't worked. You wouldn't be here. You wouldn't have come to my office. You wouldn't have gone to your GP and say, hey, I'm still in pain if those treatments worked. So what we're doing here is relatively new and it's conceptual, and you don't drive around the streets and see, oh, there's a functional movement back pain training centre. You don't see a functional movement coaching studio. But you see lots of physio, and you see Pilates, and you see yoga studios, and you see chiropractic studios. What you don't see is functional movement training centres. Okay, so this is very unique. What we're doing here is very unique. And I can guarantee you that from the last 1 year of training patients like this, and I'm coming towards the end of my spinal surgery career, I can tell you that throughout my training and my experience, nothing has amazed me more than to see people adopt functional movement training and recover and improve to the degree that I have seen
using this approach?
Because there's so many people out there with back pain, and up to 80% of people in their lifetime will have an episode of back pain. At any one time, about 30% of people have back pain. And 1 in 10 of those goes on to have chronic pain. That means lasting longer than 6 months. So it's a huge problem, and it costs us as taxpayers around $50 billion a year. If you listen to the radio this morning, the president of the AMA is on the radio saying, waiting times are blowing out, there's no money, we've got to start increasing taxes to pay for healthcare. This is one area. Back pain is a huge area in terms of the economic burden of disease that we need to improve on. So I think you guys are in the right place. Now, when we talk about movement, we're going to incorporate something called functional movement. Now, you probably don't have a great understanding of what functional movement is at the moment. I'm going to give you a few little pointers as to what functional movement involves. Okay, it's just so that when you're doing your training, you're going to think, oh, why is Coach Loz making me do this? Or why is Coach Loz making me do this? Why can't I just do this? And I'm going to give you a bit of a concept of what we're thinking about when we're coaching you. So there's really five elements of what a functional movement is, and 6 is a bonus. So compound, efficient, natural, it's driven from the core. So we've all heard that buzzword, core stability. It's a core-driven movement, core initiation. It has a unique ability to express power. Okay, that's a very important element. So it's powerful. And the last one is it stimulates adaptation, so you adapt. So let's just quickly go through this, and then we're going to get into some training. Compound. Chris, what do you think compound means?
Made up of lots of different things.
Yes. So a compound, which is going to be a core movement, this or this? Yeah. Because how many joints am I moving when I do that? A lot, my whole body. Okay, that's a very good compound movement. So we will probably be getting you to do some of those at some stage through the program. Efficient. Efficient means there's one way to do something the best. Okay? There is one efficient way to pick up that. There is one efficient way to put something on a bench. Okay? You could sort of go like this if you wanted to and put it up, or you can sort of do some funny little break dance and pick it up. That's not efficient. There's one efficient way to do it. So a functional movement is the most efficient way to do the movement that we're trying to get you to execute. They're natural movements. Okay? So a natural movement means that I can go all over the world and I can look at a toddler, I can look at an adult who has no health issues, and they will do that movement the same way. So if I go to China or the Himalayas and I'm looking at toddlers, they will pick up their toys like that. They will squat down. And no one trained the toddler to do that. It's programmed in their DNA. It's programmed in their spinal cord. Similar to other animals. Birds start flapping their wings. Why? Because it's programmed. And functional movements are programmed into us. Core initiation. Very similar to a boxer throwing a punch. When that boxer throws a punch, he knocks out his opponent. Where does the power come from for that punch? It comes from his core. So it's initiated through his core muscles, and the energy from the strong contraction of the core muscles flows through to his fist. And that's a core-initiated movement. If you throw a punch and don't activate your core and just do that, there's no power. Almost like, and another example would be when I crack a whip. I hold the handle, I crack the whip. The power of the whip cracking is stemming from the handle. The power is transmitted from the handle to the whip, the tip of the whip, and that cracks. So the power is driven from the core, and like I did that squat before, when I do that squat before, I initiated the movement from my core, not my toes or my fingers. And what's the one thing that we need to all get stronger with? The core. So fantastic. That fulfills our criteria of a functional movement. The last one is that it's a powerful movement. When we do functional movements, we have the ability to move things quickly and over a longer distance. And that is equivalent to work. So work is expressed in joules or kilojoules. Now if I do a lot of work, if I do a lot of work quickly, I'm expressing greater power. So if I carry a 10 kilogram box up those stairs, and I go very, very slowly, and then I do the same 10 kilograms up those stairs very, very quickly, I've done the same amount of work in kilojoules, but the power that I've expressed, the rate of work that I'm doing, if I go up very quickly, if I run up those stairs, the power that I've expressed is twice as much. If it takes me 30 seconds and then 15 seconds, the power that I've produced by going up in 15 seconds is twice as much as the power than when I went up in 30 seconds. And guess what I'm going to feel after doing it in 15 seconds? I'm going to feel puffed, as opposed to going up really slowly. I'm not going to feel puffed at all. But I've done the same amount of work. I've moved a load, 10 kilograms, a certain height. That equals work. But I've done it, if I do it quickly, I've expressed more power and I feel puffed. And that equals intensity. Now you think, what's going on about now? Why is he talking about intensity? The reason I'm talking about intensity, is because intensity is essential in our rehabilitation. And that's also something that was strongly lacking in your other rehab programs, a lack of intensity. Why do we need intensity? If we want your bodies to change, if we want your bodies to grow, if we want you to get stronger, your body needs a stimulus. And that stimulus is intensity. And that's why we do functional movements, because functional movements have the ability to generate intensity much more effectively than non-functional movements. Okay, so if I do this, I could probably do this very quickly for a long time, and I'm not getting puffed. Whereas if I do this very quickly, which is a functional movement, I'm starting to get puffed already. Okay? But this I can do for ages. It's not a functional movement. There's no intensity, and therefore my body is not going to adapt as quickly and become healthier, or in your case, more athletic and have less pain, which is our ultimate goal, and become more able to do your daily activities as if I did with functional movements and did generate intensity. Okay? So that explains to you the underlying basis and the scientific basis for what we're doing. We're not just making it up. We're not just picking up a few exercise books and saying, okay, let's make patients do this and this and this and hope for the best. There is a very sound scientific, biomechanical and physiological basis to the training program. And the better you are at this, the better you are at doing this program, the better you are going to be in life in general. Okay? Because you've tackled one of the hardest things of the triangle. These are fairly easy to tackle, okay? But this is the hardest to tackle, and it's the most deficient area for you guys. Okay? That's all I wanted to say. If there's any questions, barrel me up and I can talk about it. But does that make sense to everybody? Yeah, when you step through it, it's really quite simple.